So I've been asked to talk a little bit about what the World Health Organization is doing to bring this agenda of WASH and NTDs together. As all of you know, WHO's remit is to issue normative guidance for member states and ministries of health and their partners to deliver their work. We're not an implementer as such. But what we're trying to do, sorry, I keep saying we, I'm doing this on behalf of WHO, but I'm actually with the Schistosomiasis Control Initiative, but SCI is a partner of WHO in this work. And what we're trying to do is really make collaboration as practicable and as possible for partners on the ground. So that's basically what I'll be talking about today. So, in terms of where WHO is coming from, a lot of what the department that I have been working with is focused on is the transmission of pathogens related to water and sanitation to human excreta mainly, and preventing that transmission through improving services around water, clean water, improved water supplies, and improved sanitation systems. And this diagram actually comes from our very recent publication, the Guidelines on Sanitation and Health, which I hope you'll all pick up and read. It just came out last month. But also acknowledging that disease is only one aspect in terms of the impact of water, sanitation and hygiene on human health. There are broader aspects as well, some of which are related to the disease and the further implications of disease throughout the lifetime and through generations, but there are also aspects to do with dignity and broader well-being. So when we talk about the impact on health, we mean the WHO definition of health, which is not just the absence of disease, but overall well-being. So you may be surprised to know this, those of you who work more closely with the WHO NTDs department. There is actually a department on public health, the environment and the social determinants, and within it is a small unit focusing on water, sanitation and hygiene for health. And this gives you an overview of the unit's strategy and focus areas, and you'll see that neglected tropical diseases is one of the focus areas. Now, you may think that for a department that's focusing on very big issues such as global monitoring on access to water and sanitation, and very crucial aspects like preventing cholera outbreaks and looking at supplies of water and sanitation in healthcare settings, that NTDs might be a bit of a niche area. But the way I see it and the way we see it is that NTDs are an area where we're at the forefront of getting the WASH and health sectors to work together, because there are very urgent imperatives on both sides to do this, and I'll come to that in a second. So what has WHO been doing on WASH and NTDs? And this is a relatively new area, and at the end of 2014 we started a collaboration across the two departments, public health and NTDs, and that collaboration focused on defining a global strategy on WASH and NTDs, which is time-bound and sort of matches the same timeline as the global roadmap on NTDs. And this strategy's vision is to improve WASH in order to help achieve NTD objectives in terms of control, elimination and eradication. And it had 4 strategic objectives, and all of them are very focused on things that are required to get sectors to work together, from sharing information through to joint monitoring, joint planning and improving evidence. And this strategy also had an action plan attached to it, in which WHO is committing to doing a whole series of things, but there are also demands from countries, from ministries of health, from donors and partners who are working to tackle NTDs. And the main premise of this is a Venn diagram that I actually used last time I presented in this conference, which was too long ago. But basically that We, as two sectors, have our own goals and objectives. The WASH sector very much focused on increasing access. These days it's about universal access, everyone, everywhere, with access to safely managed water and sanitation services. And on the NTD side, we have a whole set of objectives around disease control, elimination, eradication, and management of well-being of people who are affected by NTDs. But we need each other in order to achieve these objectives and goals. Part of the process of trying to get the sectors to work together is defining what those goals are and being able to work together to achieve them. So NTDs tell the WASH sector where the need is, where are the people that we're not reaching with water and sanitation services, because a lot of these diseases are related to either transmission through water and sanitation related pathways, or their treatment and care relies very much on having access to water and sanitation. So what we're trying to do is not to bring the other sector into our sector, but we're trying to meet in the middle and say, if we're to achieve the sustainable development goals and our objectives around improved health and well-being, we've got to work together and collaborate. So that's all very well. But actually, it's been quite difficult to find those common goals. And I think a lot of us who are working on the ground will be familiar with the fact that it's quite easy to say that, well, we should be working together and it makes sense. But actually, if my ministerial budget is just to go around and distribute tablets, then it's very difficult for me to say, no, I've got to do all these other aspects as well in order to prevent the disease, because my institutional structure and the objectives that I'm working towards just simply don't allow me to do that. And it's the same on the WASH side. So what we're trying to do is tackle this issue at all levels. So the first level is getting the global objectives right. A lot of you will be familiar with the NTD's roadmap, which comes to an end in 2020. And you'll know that WASH is one of the 5 key strategies mentioned in that roadmap. However, there isn't really a target or an objective on WASH that all of us are held to account for. So if we take, for example, soil-transmitted helminths, very, very, very related to sanitation, the target for SDH has been, up until now, coverage of the population with medicines. Nothing really around preventing the transmission of the disease. So one of the first exciting things that have happened recently is in defining the goals for the new roadmap, the SDH target has changed to a morbidity target rather than a coverage target, and within it we've got a target on sanitation and a target on hygiene. And the idea is that if you have that kind of target at the global level, there is an incentive to work towards it at a national level. But that's not enough, because underneath these goals and objectives and all these other jargony words that I'm throwing at you, there's a whole architecture in which programs are actually structured and delivered. And this is the reality that we normally come across at a country level. If I think about a few of the countries that we've been working on, these quotes at the bottom of the slide, which you're probably not able to read actually, are very real. So, okay, well, we had a first meeting, we tried to involve the WASH sector, but actually they don't really care. They say, well, trachoma doesn't matter for our objectives, so they won't engage. Or, well, they came to the first meeting, but that was about it. You know, we can't get them to come again, we can't pay them per diems. Or we need them more than they need us, they've got all the money. We as an NTD program can't really convince them to engage because there's nothing in it for them. So getting past that initial stage of getting people to meet and agree that it's really important to do something together is very different to deciding what actually needs to be done, who's going to do it, who's going to pay for it. So as WHO, we acknowledge the fact that we actually need to help countries or guide them in a step-by-step way to get to that operational point. So something exciting that should be in your inboxes within the next month. I keep saying this, but you guys don't know that. As far as you know, I've only said it now for the first time. We have partnered with the NNN, the NTDs NGO network, to actually put down in paper what it will take to get the two sectors to work together. And excitingly, it takes the shape of a toolkit. And I know it doesn't sound like much, but hopefully I can get you excited about it. So this is what it might look like. It's a computer simulation. But basically, what this toolkit aims to do, and it's a very brief narrative accompanied by 21 tools at the moment. There'll be 22 by the end of this week, right, Fiona? Yes. What it aims to do is actually support the people who are working on the ground, national program managers and their partners, NGOs or government, to build partnerships with the other agencies that they need to build a partnership with. And I can't stress this enough. This is important because a lot of the ministries that we support on the ground don't know who the WASH sector is, don't really know what to say to them in order to engage them. And once they have, they don't really know where to go next. And the tools take you through a step-by-step process to build a structure, to develop a comprehensive approach to dealing with some of the more thorny issues around WASH and NTDs, such as changing people's behaviours and getting access to services in hard-to-reach areas. And all of that is done in a way that aims to strengthen the existing health system rather than creating a separate program structure. What this is based on is some of the other documents that I've touched upon, but it very much emerges from concrete examples of working on the ground, a lot of it based on the experience of trachoma elimination programs, and it builds on the toolkit that was developed by the International Coalition for Trachoma Control, All You Need for FNE, very catchy. It also builds on the framework that's been developed by the NNN, the NTDs NGO network, called the BEST framework, which basically states that tackling NTDs requires action on all areas, including behavior, environment, social inclusion, and treatment. And if you're really serious about addressing a disease, you've got to work on all of these areas. But most importantly, it emerges from actions and materials that have been implemented on the ground in several countries. This is more or less what the structure looks like. So it takes us from setting a program vision to finding partners and developing a partnership, through to conducting a situation analysis, designing a program, and then monitoring and evaluating that program. So very straightforward program management stuff. There's no rocket science here. There's no groundbreaking stuff, apart from the fact that it does what doesn't tend to happen on the ground just yet. So we'll have a printed version, and there'll also be a very snazzy online interface, which should be moving any moment now. No, it's not going to do it. Sorry about that. But basically, you'll be able to use this interactively and download the tools and use them as you see fit. So as I said, that's coming in the next month or so. But I don't want you to think that we feel that we've solved the problem by developing a toolkit. That would be absolutely silly. And I would never ever say that. We can't really assume that because we've put things down on paper, even though it's the first time that it's being put down on paper, that that's going to solve the problem and people are just going to use it and do everything that's needed. We acknowledge that there's a lot of guidance out there, and this whole notion of doing really concrete things that are important, like joint data collection and data sharing, isn't reflected in all of WHO's guidance. So having done this, we need to make sure that this is consistently reflected back to national program managers who are very busy people and have a lot to do on the ground, and what they don't need is conflicting guidance from WHO on this. So that's the first thing. The second thing is that we can't really do this without having a solid community of practice, and this is where conferences like this, the NNN and other disease-specific communities within the NTD sector are crucial to make sure that we're taking these tools, applying them on the ground, coming back with real experience of what it means, what it takes to implement them, and refining the tools even better. The last point is really pretty crucial, because none of this is meaningful unless the architecture of how sectors are built on the ground changes to reflect this new thinking. It's not new thinking, but it's new in the sense that a lot of the financing structures that we're seeing on the ground are still pretty rigid and pretty vertical. And this issue of not having the right budgets in the right places is really crucial. One program manager from a country that I shan't name is a fantastic champion for working with the WASH sector, has even appointed a national WASH and NTDs coordinator in his program. But he lacks the $6,000 a year he needs to run coordination meetings with the WASH sector, because this costs money. But he doesn't have the flexibility in his budget to do this, and this is what we need to make sure changes on the ground, as well as investing in capacity and really making sure that we're strengthening the existing system and not supplanting them with a top-down project that's going to end in 2 or 3 years. So a lot of work still to do, and I hope that today we're going to get a glimpse of what else is being done on the ground to make this happen. Thanks very much.